Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Carvedilol. Its brand name is Coreg. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Carvedilol is a non-selective beta-adrenergic blocking agent, or a beta blocker. In terms of indications for use, Carvedilol is indicated to be used in the treatment of hypertension or high blood pressure. We see this medication used in the treatment of heart failure, and it's also indicated to be used in the treatment of impaired left ventricular function. Now, before somebody was to use Carvedilol, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. This medication cannot be used in patients who have bronchial asthma. Patients with decompensated heart failure that require IV ionotropic therapy cannot use Carvedilol. If a patient had a hypersensitivity to Carvedilol or any other component of the product, they would not be able to use this medication. Patients with second or third degree atrioventricular block cannot use Carvedilol. And it also can't be used in patients who have severe bradycardia or slow heart rate unless there's a pacemaker in place. And finally, it cannot be used by patients who have severe hepatic or liver impairment. Now, in terms of precautions, patients should be made aware that heart failure may worsen during dose increases. Bradycardia with a pulse rate less than 55 beats per minute may occur, and the dose may have to be decreased. Syncope or fainting and orthostatic hypotension, or a sudden drop in blood pressure when going from a seated to a standing position, may occur, especially during initiation of therapy. Patients should be told not to stop this medication abruptly. It should be stopped slowly if discontinuation is necessary. In patients with diabetes, this may mask some signs of hypoglycemia, such as a rapid heart rate or tachycardia. And finally, for precautions, this medication should be used cautiously in patients who have renal or kidney insufficiency. Once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Carvedilol, they can expect to receive their dose orally. So if somebody is using Carvedilol to treat hypertension or high blood pressure, they would typically start off with 6.25 milligrams taken twice daily. The dose may be doubled every 1 to 2 weeks, and the maximum dose would be 25 milligrams twice daily. If somebody is using this medication for an off-label indication, such as angina pectoris, they may use 25 or 50 milligrams twice daily. As with all medications, there are some side effects or adverse reactions that patients may experience while using Carvedilol, so I'll go over some of those here now. Bradycardia, or a slow heart rate, may happen up to 10% of the time, and hypotension, or low blood pressure, can happen up to 20% of the time. Up to 7% of patients may experience peripheral edema or swelling. 10 to 12% of patients may experience abnormal weight gain, and up to 12% may experience hyperglycemia or high blood sugar. Up to 12% may experience diarrhea, and up to 33% may experience dizziness. 24% of patients using Carvedilol may experience fatigue. Now, some more rare but serious side effects would be atrioventricular block, Stevens-Johnson syndrome or toxic epidermal necrolysis, aplastic anemia, and status asthmaticus. Now that's all we're going to talk about today with Carvedilol. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.